In today's day and age, I guess you could say, everybody's sort of focused on biohacking, doing all the right things, testing, tracking, all of these things, and somehow they still end up getting sick. What do you think is sort of missing from their repertoire of health and fitness tools?
Well, first I'll say I know a lot of biohackers, and I know that they're stressing out trying to do all the perfect things in the biohacking world, and that stress is far more damaging to them than doing the latest thing that's supposed to make them feel live forever.
Right.
So I see it. You've seen it. It goes through the community. First of all, walking the walk, talking the talk, and that means really learning how to relax, knowing what's real, asking the right questions, not just jumping on the bandwagon when there's something new that just came out. Oh, I want to go do that. They need to learn how to ask the questions, what's scientifically sound, and more importantly, what's safe.
Right. So on that point of what is safe and what is not, I've heard many opinions about seed oils, and none of which have been from an actual doctor like yourself. So what are they good? Are they bad? What are seed oils? Why are they bad for us? Why are they good for us? What's the deal here? Because I'm hearing a lot of conflicting messages.
Right. So it's a new thing, a new topic, although we've known for a long period of time that if you heat the wrong oils to the wrong temperature, it causes trans problems in those oils. We know it's bad for us. Now everybody's catching on, and I'm glad. I'm glad. So there is truth to that the oils, when they are heated, or there's certain types of oils that are made with different plants that aren't necessarily good for us. We still have a ways to go to really prove how detrimental each one or beneficial each one is. We know the good oils.
Yeah.
We know omega-3s. We know the benefit and all that. But are all of the seed oils as bad as we're making them out to? Maybe, but right now, I don't know that we have enough to ban all of them.
Yeah, so the evidence suggests that maybe they're not great, but we have no real idea how bad.
Right. I think they're bad. How bad and how much and for what person? Can your body and your liver handle it better than mine can? We don't want bad things in our bodies. We don't want to put it there.
Right.
So, yes, I'm glad we're starting to clean up our diets. It has to be done.
Okay.
But again, if you're not going to eat, or you're going to be stressing out over something had a seed oil in it, that stress could be far more damaging than the seed oil ingestion.
That's actually a really interesting point, because a lot of these people are like, I've seen videos of people faking allergies at restaurants, saying, "No, I'm allergic to canola oil or whatever oil you put on your fries. I need either beef tallow or butter." And it's like, well, maybe that entire rigmarole that you're going through, that whole stressful process, like you've been saying, is more detrimental to your physiology than the little bit of, canola oil or whatever it is, right?
Right.
Yeah.
We want to be mindful of what we're putting into our body. And when we're eating at home or we're in control, choose the right things and eat that. But when you're out with your friends and you're doing things, don't stress the whole table out, right? That or don't only eat certain things.
Yeah.
I was with actually James Nestor, who wrote the book Breathe. We were at lunch and we were expecting another person. I won't say who it is, but I will say very much into biohacking. And before we got there, we prepped the waiter that when he gets here, you better know your menu, whether it has seed oils or not. Literally, he had to go back to the chef in the background, right? And the chef came back and they said, you can have this, this, and this off the menu. Great, right? Of course, the person got the date wrong and didn't even show up. So we spent 10 minutes of our time, right, worrying about the person with the seed oil issue. But I respect it. And we can't make fun, but I think we need to lighten up, and it's all about variety and diversity.
Yes.
A little bit of this, a little bit of that, both good and bad. The more diversity that we have in our diet, the more protection we're going to get. Because, people say, how much of this do you want to take? How much of that? We don't know all of it yet, but I know that it's like the microbiome. The more diverse those bugs are, the better off we are. And I think that we should be eating different foods and different, they say different colors on your plate. Remember that?
Right.
We're not talking about that anymore. Just eat different colors on your plate. Diversify and don't eat the same thing all the time. If you have a food allergy or if you have a problem with something, if you're eating the same foods over and over again because you're scared to eat everything, that could be a problem. You're lacking nutrients. And I say rotate your toxins and rotate your nutrition. Rotate it.
I like that a lot. It's everything in moderation, right?
That's
like
right.
one donut won't kill you, you know what I mean?
Right.
But having 5 boxes every hour for a week may do some bad stuff,
Right.
you know what I mean?
You know, if you can eat that donut, Justin, and love it in that moment and say, okay, I'm back to my healthy eating afterwards, but I believe in my body. I believe that it can take this hit. It's not healthy, but I'm okay.
Yeah.
But if you're going to eat that donut and then be beating yourself up, the stress on top of the junk you just ate,
Exactly.
that's the double whammy.
Yeah, a lot of people struggle with this sort of mentality, especially when they're dieting, right? They're like, I don't know what it's called, but it's almost like the cheat meal effect or whatever. You string together 6 really good days, and then, you know, it's a Sunday, and you're like, oh, I'm going to have a pizza. And you eat a whole pizza, and then you're like, no, I need some ice cream. And you end up going like 5,000 calories above your deficit or whatever it is. And then not only do you not drop back into your diet, but you actually beat yourself up so much that it does detrimental things to your body. Why is that?
Well, first of all, the body likes a little bit of stress. It's good for it. It's called hormesis. That when we do something that stresses us out, be either food or too much exercise or whatever, it wakes the body's immune system up. It wakes us up. So the body actually performs better if we have a little bit of stress going on. I'm going to stress that, a little bit of stress, not every day let me eat all the junk I want, right? Yeah. So if we understand and we believe in our bodies and know that it's knowledgeable, it's got a great repair system. Now, if you're ill and you have challenges, I work with oncology patients. That's the mainstay of who I see. We've got to be careful. We don't have a lot of cheat days.
Yeah.
We can't, but they are fighting for their lives, for survival. But they feel that their food is their medicine or their worst poison. Yeah. And so they're using it in a good way. But it's the mindset of, I have to eat this or I get to eat this. Because it's going to heal me.
That's a really big sort of separation between, oh, I have to eat this, I have to eat these seed oils or whatever it is, and oh, I get to eat whatever is in front of me. I was talking with Andrew and Amber Salisbury, the CEOs of Purity Coffee, and Andrew said something really interesting to me. He said the reason why coffee, for instance, is so unregulated with pesticides and things like this is because A, it's grown outside of the U.S. and they don't have the same sort of regulations on pesticides. Right. And B, when they try to send it over to Europe, the European, I guess, customs goes, no, there's a bunch of bad stuff in here, and our food is medicine. Send it over to America, they'll eat anything. That's right. And we're like, oh, all right, cool.
We'll take it.
Yeah, exactly. We'll take whatever. So why do you think, in America especially, why do you think we're more so, food is just something we do, rather than like, no, this food is medicine. It fuels you. If you have clean fuel, it helps the sort of, I guess, conceptual car that you are, right? The vehicle. Right. If you put diesel into a normal car, it's not going to be good. Yeah. You know? Right. So why do you think there's that sort of disconnect between? Well,
first of all, I think we're waking up. You know, podcast information, people are saying, I know that what I put in my body is going to be bad for me or good for me. Right. As far as the quality, I think that we have this trust factor that somebody, the government or somebody's not going to let something into the country and get on the shelf that's going to make me sick. I think we better get over that. We know that at this point. And for Purity Coffee, which I've been drinking for 8 years and telling all my patients about, because no mycotoxins, it's actually can be used as a great antioxidant, all the benefits of coffee. Yeah. And now we know more and more about it. So it's education first and then motivation. You can learn that I'm not supposed to eat this or I should eat more of that. But that's back to motivation of, do they really want to be healthy? Right. Do they want to live a long time? Or quality of life is more important than length of life, right? So you have to look at the individual, and we have to start teaching kids at a young age. Don't say you can't have this. What does the kid want to do? Go eat the thing you just told them they can't have. Exactly. You've got to say, this one builds strong muscles. This one makes you feel good. We've got to plan it differently and do it differently. And if you go to other countries, Japan, what they feed their kids, they have to be fresh. Nothing is prepackaged. Nothing is in these containers that last forever. They have a mindset from the beginning, and nutritionists are on board teaching the kids about quality of their food. from day one.
It's really interesting.
We don't do that here, and think we're safe.
You just brought up Japan, and I think it's like Okinawa or something like this. It's one of the highest life expectancy places in the world, and there's probably no surprise that they also eat some of the cleanest food ever. It's really clean fish, lots of omega-3 fatty acids, right? You would think that we would sort of take a page out of their book and be like, oh, well, we have something like the highest obesity rate in the world, I think. And maybe, just maybe, we could do something about that if we sort of not only, like you said, educate our population about nutrition, but also motivate them to eat better, right?
Right. We can tell people that, out of the industrialized countries, we're at the bottom, and it shocks people. We have the worst, obesity, chronic degenerative diseases, cancer, heart disease, you name all the bad guys. We are one of the worst, and we spend more fourfold than anybody else. We're doing something wrong. Yep. But you can tell people that, but it won't happen to me.
Yeah.
And I don't think it can be that bad because it's on the shelf. And supplements, I've been utilizing nutraceuticals in my practice for almost 30 years. So I know the benefit, but I also know the risk. So everything that I've got that I utilize for my people, I have a certificate of analysis and beyond, way beyond that. Every single batch. I just don't trust my companies, even though I think they're trying to do the right thing. But I know what happens when things sit for a long period of time, growing bacteria and fungus. And I know that probably, and I would venture to bet that the majority, if not a large majority, of most supplements on the shelf out there right now doesn't have what it says on the label. And at worst, it's got heavy metals in it. It has toxins in there and making people worse. So we've got to be very, very careful. Recently, they just did a study on the protein powders, and out of the ones that they tested, 75% were contaminated with a higher level of lead than is allowed.
Good
Prop
Lord.
65. That's just that. But I've known that. I've worked in the industry. I was part of the team that brought pea protein to the market and resveratrol first on the shelf. So I know that manufacturing side, and that's what scares me because it and coffee and everything else, they're not regulated like pharmaceutical drugs.
Right.
They're a food. So we've gotten away with a lot, and there's a lot of bad players out there. There are, and there's some good guys. This is one reason why I'm a co-founder of a company called Prove It. And what we do is help because I got tired of saying people would say this or say that. It's, well, prove it. How are you going to prove it?
Right.
So we named it that, and it's specifically for the health and wellness industry. And that is helping the companies that are the good guys that want to show that they're doing the testing, they're analyzing the safety, the efficacy, does it work, and safety of their products. But they couldn't afford to go to regular large companies that do studies because they would throw them into a model like the pharmaceuticals. Pharmaceuticals are going to make billions, so they can spend millions.
Yeah.
These companies, good companies, couldn't afford it.
Exactly.
So we've made that model. Those that want to do it and are ready to show that we've got the best coffee purity, they're doing the science, they roast it the right way, they're really into health, into benefit. Those are the companies that everybody should be supporting. But it's hard for the regular consumer. They're going to go to the big box and they're going to get something off Amazon, and they think that supplement has got to say what it says on that bottle because they read an article that is going to help them, and they've got to be very, very careful. I'd rather them take nothing than a poor quality supplement.
So can we go to proveit.com okay, proveit.com?
Yes,
okay.
yes. Prove It Research. Proveitresearch.com.
Check out proveitresearch.com. That sounds like an amazing tool, by the way. I'll definitely be using that. 70% of protein powders with, you said, like over the maximum limit of lead?
75% is what they found. Yeah, but that's not
absurd.
Shocking to me because I've known it for years.
Oh, okay.
That's why I require every bottle that I've got analysis on.
Okay.
Even from the good companies. It's in the ground. Lead gasoline, before you were born, things that are still legacy that are there, right? All this lead. A head of lettuce has more lead in it than is allowed in a supplement under something called Prop 65 out of California. We're bombarded by these heavy metals. We've got to be we've got to, when we talk about detox and other things, how we can get those out of there. But we shouldn't be, when we concentrate things down into supplements, into powders, now it's not just in a food, a little bit in a food. Now it's concentrated into this.
It's all packed into a little capsule.
Packed in there, and that's a lot. And we're adding to something that our body was not built to be around.
Right.
We weren't built to have arsenic and lead and mercury in these things. That's
a little bit more than disconcerting, right? It's 75% of protein powder. Like that's insane. What if you were to give just sort of like one action step to people at home to, like clean out their cupboards or anything like this? What would they have to like research the companies? Where do you go to even find this research?
Unfortunately, and that's finding others like me that are just really, really tough on making sure that what we've got and what we're doing are accurate. But most people, I say, anything that's going into your mouth or on your body on a consistent basis, it's your job to call that manufacturer that's on the bottle that has to be there and say, show me that you're doing the testing. It's called a certificate of analysis. If they say, no, we're not, it's not proprietary, they're not giving away anything, they should be proud to say, I am so glad you asked. Here it is. Good for you asking. It's not expensive for the companies to do it. There's no reason to not be doing it. So any company that says no, move on. Don't buy that company.
If it's not expensive for these companies to get a certificate of analysis, what's the benefit of not getting one? Is it not, outing yourself as this weird metal company when you should be a nutraceutical company?
What if you're one of those 75 protein powders?
Yeah, I guess
they know that's there.
Oh man.
Right? So we've got to start daring to doubt the supplement companies, the health food guys, the wearables, everything, and the pharmaceuticals and the medical side of it as well. Both sides of medicine. We need to be looking for the truth, knowing how to ask for the truth, because no one's going to protect your body and your family like you. It's up to you to do this for now.
Love it. So I got a quote from you here. You've said before that DNA is not your destiny. We have the power to turn genes on and off based on how we live. What's the biggest mindset shift someone that's watching this can make, where they think, oh, well, must be nice to be in shape, but I can't because I'm genetically cursed or whatever it is.
Right. So the DNA is just the blueprint, the epigenetics, your diet, your lifestyle, and your mindset, your stress levels, all of that. They turn on and turn off these genes, the good, the good and the bad and the ugly, right? They are really what's driving it. So we are in control. There are some devastating genetic diseases, very few, that children are born with, and there's not much we can do about that now. We have CRISPR technology coming, so we're going to be able to do something about those in the near future. But in the meantime, for the regular person, we're in control. Our bodies are amazing. Yeah. They've got great repair. If you're putting in what you should and taking out what you shouldn't, they know what to do. They're pretty darn smart. So the goal is to really believe in your body and give it what it needs and take away the things that it shouldn't, which includes medications that may or may not be necessary. Sometimes they are. For me, when I prescribe a medication, it's because I have an acute issue that I know that the natural side is going to take a little more time to truly heal it and get to the root of the problem, but I need to use it. But I never think of it as a fix. Pharmaceuticals, to me, for the most part, is to steady us just for a minute while the body can actually try to do the repairing. And we're looking for the cause of what's causing that.
Gotcha. So instead of pharmaceuticals being the fix or the cure, it's more of a crutch so you can get off your broken leg until it heals itself.
I think it was Hippocrates that said, a medicine, the doctors prescribe something just to kind of keep the patient's mind busy while the body's actually doing the healing. And I think there's a lot of truth in that, because most people, as they age, they collect medications. They have one medication, you've got a side effect from that one, so now you have to take this next drug because of that side effect, and it just keeps going, and nobody knows how they interact with one another in that patient. And no wonder we're so ill. So if we're doing that and we're not exercising, we're not having processes that help us relax and enjoy, we don't have people around us, if we're doing those things, what do we expect this body to do? It's good and it's great, but it can only take so much damage. By the way, back to your Okinawa, is that when we talk about those blue zones, they're studying it. Why are these people living longer in these areas? They thought, is it diet? Is it lifestyle? What are they eating? Oh, this one drinks wine, but this one doesn't drink at all. This one exercises a lot. They did notice within that they usually have a better diet than normal, but it could be vegetarian and one could be carnivore.
Yeah.
So it's not one over the other. And that they had more movement than we generally did. But what we think the biggest research signal is, they have community around them. They have family, people around them. They feel supported. That's what they really had in common, because if you research out which diet, which exercise, they're all over the place.
Exactly.
They have community.
Wow. Okay. So that just kind of blew my head off. It's and I've sort of heard
repair
from
itself. Don't worry about it.
I've heard from many people that different diets are good for different things, right? And that does make a lot of sense to me personally. I don't really believe that one diet is the best one. You got to mix and match, kind of figure out what works for you, and also change it up, like you said, add diversity. But community being the main driver of not just length of life, but also obviously quality of life. If you have a great community of people around you, it's amazing. Wow, that's crazy. Why do you think that well, I guess this is a deeper question than medical, but why do you think that we've sort of disintegrated our own community in America? Why do you think that is?
I think it's the thing that we could answer a lot of questions along that line: power, ego, money, the things that people deem to be important, and we've forgotten the importance of our families and our communities. And I think we're getting back there. I know AI is here, and we're loving it. We've got lots of great things that we can do with it, and we're either afraid of it or we're excited about it. But in the long run, it's eventually, we believe, will allow us or lead us back into, I want to be a one-on-one. I want to see you and touch you and hug you, because AI can't do that.
Yeah, we were just listening to a talk yesterday, and the dude talking basically said the same way that streaming changed the music industry and made many people start collecting vinyls again, and made many people sort of pine for concerts and buy concert tickets and things. He thinks that AI is sort of going to do the same, because AI will never be able to learn something for you, and it'll never be able to, well, I shouldn't say never, because I have no idea, but right now, it can't learn something for you. It can't do your own push-ups, you know what I mean? Right. And it's not going to be able to hang out with you, right? It's never going to be able to replace this thing that's going on. So it's really interesting, because I definitely agree with you. When we see AI sort of take over a bunch more jobs and just like a bunch more tasks day to day, there's going to be a lot more room left for hanging out with loved ones, doing creative jobs, all of these things that we want to do more of, right? And that can do nothing but good to our health.
Right. So if we're using it responsibly in the ways that it's going to help us, and we have more time to do the things that we should, listen to music, go to concerts, be with family, cook our great good meals together, all of that, and exercise, all the pieces that we don't have time for right now. We kind of do. If you're looking at interval training, 6 minutes, 3 days a week beats hours on the treadmill. So when people tell me I don't have time, I say,
you got time.
Yeah, you do. Yes,
everybody does.
So there's no more excuses. Again, we're back to the motivation piece, right?
Exactly.
Quality of life, length of life, and a lot of people don't start thinking about that until later in life, when they start having diseases or aches and pains.
Right.
Your age, you getting into this now, I mean, how long do you want to live?
Well, my wife put down.
How long do you think you can? How long do you want to live?
270, 200.
Right. And I believe that is possible. But a lot of people don't. They don't see it, can't believe it yet. But with the belief system there, and with DNA being, us learning more about the epigenetics, how we're repairing and methylating and doing all the science that we know about, I think it's very possible.
100%.
And I think, who is it? Audrey DeGray said, the person that's going to live to 1,000 is alive today.
Whoa.
Don't quote me on that, but I believe that's the quote that he said. So your 200 may be undershooting.
Wild. Yeah, maybe I should raise my standards a little bit.
Even people my age, we can still repair. We're still doing things. I mean, we have biological age and chronological age. Now,
right.
That's a whole thing. Everybody wants to know their biological age. Well, everybody's got their own system of measuring that. In one system, I'm 13 years younger than what I am. In another system, I'm 30 years younger.
Yeah.
But I think there is truth in that concept of just because what your chronological age is not necessarily what your body's age is.
Right.
And we're in control of that.
So going back to the sort of medical kind of industry, please correct me if I'm wrong, but I think that the U.S. is one out of 2 countries in the world that can advertise pharmaceutical drugs on TV. I think it's us and like New Zealand or something like this, right?
It's interesting, though. If you look at, it's become a big joke that everybody laughs about the pharmaceutical television ads, because most of the ad, if not almost a quarter of it, is, and you also might get this and this and this, and you might have cancer. And
right.
And everybody laughs about it because you see the smiley, happy person that has this disease
and they're
that
riding
no longer
bikes
has
and
it.
stuff.
Yeah, but then you can't help but hear that last part.
Side effects may include dying.
I think we really are waking up to that. The older generation still think doctor is God and do not question a word they say. Just do what they say.
Yep.
The younger generation is going, yeah, that doesn't make sense. No, I want to know more.
Exactly.
You should be asking the questions.
Yep. Dare to doubt, right?
Dare to doubt. First semester in medical school. My mother was in the hospital. There was a medical mistake. I won't get into the long story, but they made mistakes. And here I was. I had the white coats, the guys that I was supposed to be, here, you're my teachers, you're my guy. And I said, wait. I don't have to be a doctor yet to have common sense. And if I had not questioned and got the pushback, but I questioned, she would have died 4 times. 4 times in 4 different ways, because I learned to dare to doubt and say, I need to know more. I know you're telling me as the doctor this is what you want to do, and we need to respect the doctors. They have knowledge that regular people don't. And me, as a first-year medical student at that time, I didn't have their knowledge, but I knew my mom. And I knew her fighting spirit. And when they told me she was done, this is it, schedule the autopsy, this is it, she's not going to live through the night, I said, have you been in the room? Have you been in the room to see what I'm seeing? So it's a longer story, but that's part of my talk. Dare to doubt, no matter, just because you don't have a diploma on the wall or a stethoscope around your neck. Your health and your loved one's health is in your hands. And you never leave anybody in the hospital by themselves. You ask every single step. You're not there to be friends. You're going to be respectful. You're going to be nice to people. But you're there to protect and be an advocate for the people that you love.
I like that. That's super, super powerful. Was there ever sort of a moment where, like your mom's in the hospital, she could have died 4 separate times from 4 separate causes. Was there ever a moment like that where you sort of had to question the status quo, or like the generally accepted answer of the medical field, and you were like, no, that's not right?
Do it every day still, but I will tell you how I got into the metabolic cancer world. So this is, we still in traditional medicine, the medications, the treatments are all based on DNA. 5% or less of cancers are genetic. They are damage to the mitochondria, which is a metabolic issue. All the things we're talking about that can cause damage to that, they're not genetic. Cancer is not a genetic disease for the most part. But all of the money, all of the drugs, everything's based around that. And when I read a book years ago by Travis Christofferson called Tripping Over the Truth, and this is when I was practicing. I mean, I was in pain management. I had cancer patients. But I read this book, and it just opened the door of this history and the wrong track we have gone down. And the Otto Warburg, who found that cancer feeds on sugar. It's just pretty much glucose and there's two pathways that feed cancer. One's about stress and one's about eating sugar, right? It's a simplistic view, but he won the Nobel Prize.
Wow.
But what happened is Rockefeller, this whole group came in and said, all right, we're going to do medicine this way, started studying the miracle DNA thing, and we've gone down the wrong path, and we're still going down the wrong path. Metabolic therapies, which I utilize and many of us are starting to do, hyperbaric oxygen, ketogenic diet, repurposed drugs. Those are the things that help the mitochondria and help that damage. And we're making big strides in cancer care. In fact, we're so happy. We're trying to get a paper that we had. These are multiple oncologists and researchers from around the world. I'm one of the authors on it. We were having a hard time getting published in America.
Oh, wow.
We got published in the British Journal of Medicine. So now they can't ignore us anymore.
Right.
And there's enough of us speaking up to say we need to challenge this paradigm and we need to shift because we're not winning the war on cancer. We are not. Just look at the statistics. They're black and white. We've done some good things, and the oncologists aren't bad guys. They're doing the best, but they're in a broken system.
So, like you said, you've worked with a lot of cancer patients in the past, and I assume a lot of terminally ill cancer patients.
Still do.
What's something that you've sort of learned from these people that are, hopefully not on their deathbed, but definitely could be, about life and just like sort of what to do with our time left?
It's interesting. Those that are coming to me, many of them, they've been through the traditional system. It didn't work or something happened. They're usually stage 4. That means terminal cancer patients, but they still have hope. And here's the thing. We're taught in medicine not to give false hope. I think we need to give more hope because we're realistic about what we think should happen or might happen with that patient. And they already know that. But the minute you take away hope, they don't have anything to live for.
Exactly.
And it's
What's
a
left?
very low level. Those that still have hope, maybe just for a quality of life for a week or a month, or the chance that they can reverse their cancer, which we see spontaneous remissions. It happens.
Wow.
So those people that still have that hope, even if it is their last breath because it is their time, they go out a different way. I just got a email yesterday from a patient that I've been working with for about 8 years. She was terminal, given weeks to live 7 or 8 years ago, right? She's had a quality of life. She's done well. She just wrote me and said, I'm in hospice, which was quick. It was fast. You don't want to be in hospice forever, right? But she had the long fight, felt well, did well, but all of a sudden, body said, I'm done. And she's in hospice, and she wrote me this beautiful, beautiful letter. The point is, no matter when the time is for us, if we go out knowing that we have time that we've spent with the loved ones, we've said the things we need to say, and we're able to be at peace, that's the way all of us should be blessed to have the last moments of our lives. But the ones that still have hope and they still have a little bit of fight left in them, they're the ones that not just survive but thrive.
Yeah.
They're the ones that can have a spontaneous remission that medical science cannot explain. We're like, that's not supposed to happen. But that tumor is completely gone. Now, we're doing metabolic therapies, which we're working on it like traditional therapies, and we work with them. I work with oncologists. There's a time and a place for surgery, even some chemos. Some of them make sense at the right time, right place. There's a marriage there with oncologists that are willing to look at these therapies help the chemo work better with less side effects. They help them recover from surgery, from radiation, help them use less of it, less toxic, and better effects. So there's enough of us, researchers and voices out there, to have at least wake the American public up so they can ask the questions.
Wow. That was a pretty big download just then. So we've been sort of fighting the wrong fight in terms of, the war against cancer, right? That's how could we ever have gotten set down the wrong track? Do you think there was some sort of nefarious intent there?
I think that there are a lot of great researchers still that are researching the different avenues of the genetics, of the tumor, of the patient. They're all well-intentioned, all well-meaning, and there are some things that are promising, immunotherapy, other things, right? But I don't know that, I would say this, in my experience, the doctors and the researchers are good people. They're trying to help. They're in a broken system. They're in a lockdown tunnel vision system.
Yep.
And even if they thought that they wanted to try to utilize the metabolic therapies until insurance says okay, and the patients have to pay cash for these things, it's considered over here, and they can't recommend it. They know it. They'll work with me and say, let's work together. So what I'm talking about doing with the patients is not going to interfere with the traditional therapies, because we've chosen to do that. Why would you do this to cancel that out? But I will say that, do I think there's greed and money and power involved behind this? Absolutely.
Right. I think it's something like 70% of ads on TV are pharmaceutical now, which is like, that's absurd. It's crazy. And like you said, the last quarter and sometimes the last half of these pharmaceutical companies, commercials are very fast spoken.
Comical.
Here's all the side effects you can do. Blah, blah, blah.
Death is one of them.
Exactly. It's like and it's for like headaches or something. And it's like, well, you could have a heart attack or you could have like liver failure. And it's like, whoa, maybe we can just kind of deal with this.
Why don't we find out the cause of
Exactly.
what's causing it, which is all the things that we're talking about. Let's find the cause and fix that.
You would think that it's sort of nonsensical to do like someone has stabbed me in my back, and instead of pulling out the knife and putting a bandage over it and things like this, you're like, hey, here's a bottle of pills. It'll make you feel better.
But being healthy is not easy, right? It's not easy. You have to eat well. You have to exercise. You have to do mindfulness. You have to get your stress under control. You need community around you. It's not that I can take a pharmaceutical pill and it's going to cure all of it.
Exactly.
Which I hope, and a lot of people still believe, I take this, I'm protected.
Yeah.
It's easier. Being healthy is not easy.
Yeah.
It takes work.
100%.
Discipline.
We talk about a lot on this show the separation between cause and effect, and it's super apparent inside of the personal development industry and especially the medical industry as well. It's you separate the cause of eating well and exercising every day from the effect of a great body. The cause of giving value into the world in a financial sort of model that works for you, and the effect of getting money. The separation between these two is so pervasive, I guess you could say, that that's why there's people selling miracle pills and you buy my course and you'll get rich immediately. But it's just not like that. You know what I mean? It's a lot of the times the biggest gap between cause and effect is time. And inside of that time, it's consistent, repetitive action. Right. It's the same with, a lot of the times when you're trying to build a business, or you're trying to get your dream body, or you're trying to learn a certain skill. Like you got your degree, right? It was probably constant, repetitive action. I got to wake up, go to school, all of these things. If someone is not as healthy as they would want to be, what is the cause that they could become in order to get the effect of becoming healthier?
I think they have a purpose or a passion in their life. What do you want to live for? They don't have anything to live for.
Right.
No one that they care for, nothing that they're working on. Why? So if you have a purpose and you have a passion behind that, then you go, okay, I got to do this. I got to eat this instead of this. I got to get my butt off the couch and got to get to the gym. Right? So it's that motivation. So you think about cause is that in medicine, it was early on, 30 years ago of thinking, what's causing this? So I'd say, well, what caused this person to have this issue? And then I'd say, well, what caused that issue? Well, what caused that? If you keep going down and saying, well, what caused that? It pretty much goes down to an emotional, mental, spiritual crisis issue.
Wow.
Everything. most cancer patients, if you ask them, when did the tumor grow? When did it show up? It's usually after they've had some kind of an emotional turmoil over something.
Wow.
That's common. And so if you keep asking, so why do you have pain in your joint? Well, I did this and I moved too much. Well, it's arthritis. I'm getting old. Well, did you have two knees your whole life? Why is it the left one over the right? If you keep asking the questions, it can come back down, a lot of it, to right here and right here.
Wow.
Right? And so we've forgotten that in medicine, and we've got to bring it back, because the human body, remember this amazing human body, give it what it needs: love, compassion, community.
Absolutely.
Take out what it doesn't, all this junk noise coming in here, along with the toxins and the foods and the things, right?
Yep, exactly.
And you get caught up in that. But if you do, it's amazing.
I was having a chat with Garrett Gunderson not too long ago. He's a fantastic financial advisor, and he said something pretty insightful about the human body, which I thought was really interesting. He said, emotional pain is so real and intense that a lot of the times your body will create physical pain to sort of like take your mind off of that emotional pain that's still there. But I have a pain in my joint or whatever it is.
Is it taking it off, or in which it could be, or is it just waking you up? Stop paying. You're not paying attention. So you didn't listen to the GI issue that you had, the constipation. Doesn't everybody have that? Doesn't everybody have gas? No. So you didn't listen to that. So now it's cardiovascular disease. Heart attack will get your attention.
Right.
So I think a lot of it is a wake-up call in the body.
That's actually a really interesting perspective, because I initially heard that and I went, wow, I've never heard anybody say, you have this, for example, this thing in your childhood, and then all of a sudden your neck starts to hurt or whatever it is.
Got to pay attention.
Yeah, that's actually really interesting. It's a wake-up call to, and like you've said, a lot of the times you go, well, why is that? What happened here? What happened here? And you keep going down. And then eventually you sort of get to the root cause of all of these things. How, if somebody, take my example, if somebody had a traumatic experience in their childhood or something, and it is showing up physically, what is the I don't want to say cure, but what is the way to sort of help? I guess cure is the word. What is the way to cure that sort of symptom? Right.
Well, first they have to acknowledge that there's the connection. They have to understand it and believe it and know it. And that takes thought process. It's counseling, it's meditation, it's whatever. There's a million processes out there. And meditation may work for one person, hypnosis may work for the next, cognitive behavioral therapy may work for the next. When I'm in front of somebody, if I'm in front of them for a bit of time, I know what I think is going to be the best therapy or help that they need to make that connection, that it's real, and that they can get to the point where they can let it go. You don't forget it. It's still there, but be able to let it go. And there are plenty of great teachers out there that are teaching great processes for us to be able to dig deep and go, oh, I didn't know that was still bothering me. I thought, something that somebody said to me in second grade, why'd that come up? And oh, maybe that's part of why my stomach hurts me when I see this or that. And then you start making connections, and you start realizing that it's you have the answers in here if you're not too afraid to pull them out, because we can let go of them. We can conquer them and say, they're part of me. They've made me who I am. They've made me stronger and wiser. But I understand that it does affect my physical body.
That's really interesting. I was just talking with your husband, Mr. Barry, and we sort of came to the conclusion. Obviously, he's come to the conclusion much earlier than I have, but I came to the conclusion that take sound, for example. Sound is a vibration. We're in this sort of vibrational universe, right? If, like, I have a memory right now that I'm thinking of. It doesn't necessarily exist, but it can change my physiology depending on if it's a happy memory, sad memory, I was nervous, I was angry, or whatever.
That's
right. Take stress, for example. If someone is constantly remembering a thing that makes them stress, or thinking of a thing in the future that makes them stress, that will literally do bad things to your body, right?
Sure.
So is the sort of my question is all of that to say, if I think of things that make me feel good, do I literally become healthier?
Sure, absolutely. The studies are there. We can change our body's chemistry with a thought. And the best pharmacy in the world is the one that your body makes. There's no side effects, the dosage is right at the right time. It's for you, it's personalized. So you can make good chemicals and you can make bad chemicals. Hormones change by our thought process. We know this, and people have kind of recognized it in themselves, but they don't, not necessarily making the connection to the point that they can do something about it. They go, oh, I think whenever I think about that, I get really ill. I start feeling sick or ill or feel drained out of energy. And they get it, but they first step is to recognize the connection. Second is, what's the process that I can learn to do that lets me say, oh, I just felt that. Oh, yeah. Breathe, whatever it is. Gone. Good. Remembering that we're amazing. We are amazing. The body knows what to do. Get out of the way of the mind. The mind chatter, get out of the way because it's not real. We could get a whole discussion. I'm sure you've had many guests about that. You know, how accurate is the future? I mean, we know the future is not accurate because they have no idea what's going to happen. But the past, the majority of those past memories aren't accurate. We've rewritten them. So the present moment, mindfulness, all this, and people go, yeah, but it's real.
Yeah.
And as Barry and what you guys were talking about in your interview is taking that moment to tap inside, feel your heart. Where am I? Who am I? And just, oh, I'm all right. I'll be okay. Oh, I got a cold today. It's okay. I have COVID today. You may have to cut the bleep that out of there. But it's okay.
Right.
My body knows what to do, and I'm going to give it what it needs. And part of that is a belief system that you can be okay, because placebo is real. I'm going to say that again. Placebo is real, because what happens in a placebo effect? Why does it, when we have pharmaceutical reps come in and they show us a new drug, and they'll say, oh, look, it's got 70% efficacy. And by the way, the placebo is 65. You're like, whoa. It's almost as much and sometimes better than the drug itself. But that's because of that body's own pharmacy I'm talking about. If you believe something is going to help you, guess what? It does, because your pharmacy gets activated and your body knows what to do.
Do you know about the, I don't know if it's like a theory, but it's like the red car concept. You walk outside and you look for red cars, you're going to see a lot of them, rather than being like, oh, I'm just walking outside and I'm looking for cars. You know what I mean? If you wake up and you go, this is a terrible day, I'm going to hate today, I'm not going to have any fun, chances are you're going to find reasons to not have any fun, right?
You got it.
And it's the same thing with having a great day, right? My dad put me onto this idea when I was probably like 14 or 15. He was like, what did he say? Depression is in the past and anxiety is in the future. And if you just hang out in the now, you're basically okay. You know what I mean? Right. Unless there's some sort of existential crisis or you're in danger, it's you're basically all right. That's you know what I mean? So something interesting that you said there is the placebo effect is very real. I saw this video on I can't remember what it was, maybe Instagram or YouTube, but it was basically this guy that was like, I don't think anybody's taking the placebo effect seriously enough. Right. You take a sugar pill and it makes you feel better. Mm-hmm. That's your brain changing your body. That's awesome, right? So when take for example, I've heard this this quote that's like, your brain can't really tell what's real and what's fake, what the difference between what's physical and what's imagined, right? If I wake up and I go on my phone and I watch things that make me excited, happy, sad, nervous, angry, or whatever, what does that do to my body if I wake up and go on social media and scroll for an hour first thing in the morning?
Right. Well, we entrain. So there's a law of physics. If you put clocks on the wall or pendulum clocks or even there's videos out there, you start them all at different times and they're all ticking at different times. If you wait, and these are electrical things, If you wait, they all start beating together. We do the same thing. You and I sitting for a while in time, our hearts would start beating at the same rhythm. Our brains would start entraining. It's a basic law of physics. So do you want to entrain with stress on your phone, or would you like to entrain with something that's giving you hope and happiness? So it's physics. This is not, we don't have to just do the studies to know it. These are basic laws of physics. We have been given everything that we need.
Yeah.
And we're the ones messing it up.
Yep, absolutely.
Right. And so, I literally, we started this conversation about the biohacking group. Love them. I mean, I love it. I love science. Obviously, I'm a researcher. I'm a physician. I love science. But we can get so wrapped up and the more science the more you realize we don't know. This is a lot of medicine. The more you dive down to understand the molecules, how do they work? Well, it usually goes back to energy anyway. It's all frequency based. But the more you learn, the more you realize we don't know.
Right. I see people on social media, especially in like health and fitness, they're arguing this shoulder exercise is better than this shoulder exercise, which is better than this one. And it's like, guys, we're arguing about shoulder exercises is like going to the airport and being like, which airline is the best airline to get me from here to Nashville or whatever it is. Yeah. And it's like, well, they're all going to get you there. Yeah. Yeah. Right? Yeah. Like this, like they're all going to get you there. But really, which one's the best?
It's pretty simple. Which one feels the best? Which one gets your gain? Where you're getting your gains? You have to try it. We're all individual.
Yep.
We're not just one person that we're all cloned of each other. We're very different. What's good for me, food-wise, may be terrible for you. I may have a sensitivity to broccoli. It's supposed to be healthy, but if it causes inflammation, it's not.
Yep.
We have to learn and understand our bodies, and some of it is paying attention. We've got great tests to be able to see these things now, but a lot of it, people ask me, what about this? I said, well, how does it make you feel? Which one of those do you feel better on? Well, I feel better when I eat this and that. I said, do you need to take a test?
Yeah,
your body.
I was just talking with my buddy Eddie Pinheiro, and we use this example in business, but it's the exact same in health and fitness. Everybody's just kind of winging it, and we're going, okay, I tried 10 things. These 2 I really liked. They made me feel good, and these 8 I didn't. I'm going to do more of these 2 and less of these 8. And then you just keep doing that until you kind of figure out what works for you, because one of the best pieces of advice I've ever gotten is nothing is ever just one way. Right. Nothing is ever just one way. It could be for you, but that's just for you. There's 7 point something billion people in the world. There's no way that we could all agree on one thing ever. You know what I mean? And
then there's that hormesis that I talked about.
Yeah, that's really interesting.
You have those 2 exercises that you like the best. Your body's going to desensitize. It's not going to work for you. You got to shake it up.
You got to shock the body.
You have to shock the body, and we do the same thing with cancer patients. It's part of our process. It's called press pulse. Certain things we press on hard, we don't let go of. We stay in ketosis. To keep the patients where ketones are there, they're fighting the cancer and they're not feeding the cancer. There's certain things, but other things we press in and out. Hyperbaric oxygen, it's in and out. It's a protocol. 5 days on, 2 days off. Fenbendazole, any of these repurposed medicines, 3 days on, 4 days off, because cancer is smart, finds a way around it. And you've got to keep waking the body up and
100%.
say, whoa, pay attention to me.
Yeah.
That's the same thing with your exercise routine. We know that. Science, we already have
Absolutely.
the data. You have to switch it up.
Yeah. I think one of my favorite bodybuilders in history, he was Arnold Schwarzenegger, and everybody knows him. I grew up watching Conan the Barbarian, and I was like, oh my God, this guy. And what he used to do when he was growing up in Austria, I think it was. Yeah. He would always work out at the gym, and then every so often he would go into the woods and do like 400 or 500 squats or something like this. And he was like, yeah, you have to shock the muscle, and then it'll grow. And it's like, oh, that makes sense, because if you do the same 100 push-ups every day, your body's going to get used to it eventually, and you'll sort of hit a plateau on that, and you may have to either add reps or stop for a while and do something else or something like this. I've never really heard someone equate that to supplements or medication. Would that mean, like, kind of extracting that logic and putting it onto supplements, would that mean that if somebody has a sort of daily supplement stack, they should almost be like cycling their supplements?
I believe so. More is not better, and I must say that 1,000 times to each one of my patients. More is not better. You know how they're interacting with one another. First of all, are they quality? First,
right? How
do they interact? Too much vitamin C causes kidney stones. People think that just because it's a supplement, it's safe, or an herbal. It's not. So, we've got to understand that probiotics is a great example. Mm-hmm. Different people have we're born with a microbiome thumbprint. It's ours, not like anybody else's. Antibiotics and other things kind of screw up our thumbprint as we go along. However, 1 antibiotic, we can get back to the thumbprint. 2, it takes longer. 3, you're probably got a new thumbprint, right? But with probiotics, which probiotic is best for you in this moment and your whole makeup? I tell people, especially with probiotics, with those bugs, until we really, really know more and I can test you, do a biomarker, and know exactly what you need in this moment, rotate your probiotics. Next bottle, go to the next brand. It doesn't mean stop taking certain things. Now, I will say with cancer patients, we have to be careful with probiotics. There's signals that some of these things we may not be needing to do because we don't really understand what they're doing with the immune system to a full extent. More is not better.
Yeah.
Personalized is the only way to go. With 100%. Somebody, a doctor that really understands it and knows what they're doing with it.
So if somebody at home, and this is also a question for me, if I wanted to go test what I'm deficient in, is that a blood test, or is that you said, a biomarker?
So there's different ways to test. So the way I like testing, it's in white blood cells, a company called SpectraCell, and you draw your blood, and they look for the different amino acids, vitamins, and minerals. If we're deficient in those are the ones that make sense to get back on, right?
Gotcha.
To say, why are they? But the first place is look at your diet. Oh, you're not eating this and this, because you've narrowed your diet down. Well, just eat more of this.
Yeah.
Do you need a supplement, or can you eat more of these foods?
Yeah.
That's the first place. Second is, let's get it back to where it's normal. Now, if it drops again when you stop taking the supplement, there's probably a genetic SNP, something there that maybe you need to be on this for a long period of time. If you have an Lp(a), it's a type of cholesterol. It's one of the worst ones, if not the worst one, that's tied to heart disease, heart attacks, and strokes. This is the guy you should be looking at, not just some doctor saying, your cholesterol's high, your bad cholesterol's high, you need to be on a statin. Well, guess what? Statins don't touch Lp(a). But what does? Do we have a drug? No. They've been trying to get it. There is one in development now. I think it's in phase 3, a drug. But guess what helps with Lp(a)? Niacin. It's a B vitamin.
Oh.
So you have to understand all the pieces and not just be thrown into a pool of people with high cholesterol, get on a statin, or do the different types of drugs. So these kinds of specialty tests are good to know. They're good to do.
Yeah. I've heard a lot of people, there's this sort of like cholesterol debate going on social media and other platforms right now.
Yeah.
Like there's things like, I guess eggs have a high level of cholesterol or something like this. And I suppose, not all cholesterol is created equal. Some of them are good, some of them are bad, or whatever. Right. But to be thrown in this bucket of, well, you have high cholesterol, so your risk of heart disease is gone way up. Is that true? It feels like it's not.
No. Well, a couple of things. As we age, we need more cholesterol. It doesn't need to be lower. What are we doing to our seniors? We're dropping the cholesterol so low because we're worried about heart disease or heart attacks. I mean, it's a thought.
Yeah.
But cholesterol only becomes part of a plaque that is that clot that we're scared of if there's inflammation and calcification. So antioxidants get the inflammation down. The cholesterol's not, most of it is not going to stick. Now, Lp(a) is a bad guy.
Yeah.
But the cholesterol makes hormones. And if we get our cholesterol too low, you can't make hormones. Cholesterol's not a bad guy. It's part of a bad thing called plaque. But we can manage that.
Yeah.
And do eggs have cholesterol in it? Yes, but they're a perfect protein. And the science is showing us that we probably don't need to be worrying about that. If we're eating bad foods and causing triglycerides to go high, now that's a problem. Again, it's individualized. It really is. And looking at family history on that one's kind of important.
Gotcha.
If everybody has Lp(a) and we have a lot of heart attacks and strokes going through the family, we probably want to be on some niacin.
Yeah. Gotcha. So going back to what you said about ketosis, a lot of people think that keto is a diet, but actually it's short for a literal metabolic state, right? When you're in ketosis, you're burning fat. There's your body produces ketones or something like this. Can you talk about that a little bit?
Yeah, so it is a ketogenic diet. If we're using the diet to get there, you can take exogenous or outside ketones. You can take some that have been made, like Keto Start is a great one. It's a good quality product. You can put ketones in. It makes your hyperbaric oxygen work better. It helps you with your workouts. You can do that, but if you want to produce your own, you've got to, the way to do it is really with your diet. And it's not people get confused and think it's Atkins and high protein. It's not. It's a high fat diet. Good fats, good oils, avocados, MCT oil, all the good oils. Has high fat, a little bit of protein, enough protein to sustain your activity level and your muscle level, and very little carbohydrate, which is pretty much coming from some vegetables and a handful of berries, if we're lucky. But with cancer, we've got them at 70% fat.
Oh, wow.
70% fat. They've got to be in ketosis. If they are, tumors are shrinking. They're doing better. We're using ketones to fight the cancer and to not feed the cancer with the glucose. Now, a regular person saying, I want to shed a few pounds, okay, but what most people are doing, they're not doing it right. They're going, I tried keto. Well, how were you testing it? Well, I wasn't, or I used urine strips. That's not testing it. Were you producing ketones? If you were, you were in ketosis, and you get the health benefits. You're killing off a few cancer cells. You're shedding some weight, and that's a great thing. And by the way, the brain loves ketones. It's the most it's the cleanest fuel we've got. Fat's a nasty, bad fuel for the whole body, especially the brain. Ketones are good.
Gotcha.
So I like going through and tell patients a few times a year, go through and let's do 6 weeks. Let's do a 4 to 6 week ketogenic diet. You want to shed some pounds. You want to work on the immune system. And the more we find out about the ketogenic diet, I think we should all be rotating that in and out. Otherwise, it's Mediterranean diet, right? That's the most science, healthiest diet out there. But you've got to test which foods are causing inflammation in you. That's a blood draw. Not food allergies that are anaphylactic, you know if you had them, but which ones cause inflammation.
Gotcha.
And you got to get the right company because everybody's doing it now and they're not what we call reproducible. If I send blood out to the same patient, same day, to the same company, you better come back looking alike. When it looks like two different patients, that's not a company I use. So I'm tough, man. These companies, I'm tough on them. As a researcher and scientist, I do that kind of thing. Yeah. Most doctors don't have the time.
So obviously I'm not really well versed in the whole metabolic state kind of deal. How, in a very simplistic sort of explanation, how does eating more fat burn fat? That seems counterproductive.
Yes. Well, it's helping you get into a ketogenic state. So your body's producing the ketones, right? If there's no glucose around, the body goes, where's the fuel? So it says, I'm going to use ketones. Where are they going to get that from? From fat. So they're going to dissolve the fat to help you make the ketones to go and have the fuel that you need. Okay. It's a simplistic explanation. But
gotcha.
It's metabolically, our body really likes that. And if you look at some of the, if you look at the Eskimos or other people that eat a lot of fat, like 80% is blubber, whale blubber. That's pure fat. And they don't have cardiovascular disease, even if they're obese. So we're learning more and more about it. Our body loves oils. It loves good oils, not the seed oils we begin with, right? But I caught my dad today. He's 91. He golfs 18 holes 3 or 4 days a week. He goes to the gym and works out lifting weights at least 5 days. He goes dancing most nights, but he's doing hyperbaric oxygen ketogenic diet at 91. Without that, we start noticing that age, right? But where was I going with that? You asked me a question when I got into Dad. Can't remember what it was, but I'm just saying that different diets for different people at different times are going to help them achieve this quality of life. Yeah. Right?
So you recommend cycling keto once or twice a year?
I think it's a great idea. People, especially if they've had cancer or having, if they have cancer, active cancer, we get them into ketosis.
Gotcha.
Right.
So for someone like me that's trying to actively build muscle, Is ketosis a proper sort of state to be in? Is being on a ketogenic diet
I'm going
nice?
to hook you up with somebody that you're going to love, and I don't know if you can get him on the show, but I'll try to help you. Dr. Dominic D'Agostino. Okay, he is funded by NASA and the Department of Defense. He studies our super soldiers, the Navy SEALs, the astronauts. He studies them with immense physical pressure and emotional, mental pressure. What were the diets and the exercise programs that'll keep these guys going, right? What did he find? Ketogenic diet, hyperbaric oxygen, but he found at the same time cancer cells, apoptosis, exploding. He said, well, good grief, this is working on cancer. So he connected with Dr. Tom Seafried out of Boston College, another person that people should follow. He's starting to actually do some YouTube videos, and he's a researcher.
Amazing.
Kind of our leader in the research. But now we know, and a whole team of us, is that this is fighting a lot of things: neurodegenerative, Parkinson's disease, MS, ketogenic diet, and hyperbaric oxygen are two mainstays. Everybody's into stem cells and all of this. Guess how you increase your own stem cells more than 8-fold? Your own hyperbaric oxygen treatments.
Wow.
And 15, that's out of Harvard. So, and we've got to be careful with some of the therapies that we're saying, here everybody should be doing this, this, and this, because there's research, I'll say, concern with some of these things that extend your life cells, they may be doing the same thing with cancer cells.
Right.
So we've got to be very careful with the newest, latest, greatest until we know more, in my opinion.
Gotcha. Well, yeah, of course, nothing is ever just one way.
Right.
But
what I was going to tell you about Dominic D'Agostino, just take a look at this guy who eats sardines when he's traveling and all. I think it was, I forgot what it was. He lifted, he broke a powerlifting record after how many days on a fast and he's a ketogenic guy. So you want to learn about this world? That's a fun place to learn.
Mr. Dominic D'Agostino?
Dr. Dominic D'Agostino.
Gotcha.
He's the real deal, real science, and just take a look at him and who he's treating, or not he's treating, he's not a doctor, but you'll say, yes, I can build muscle. And how do we keep muscles on our cancer patients so they don't waste away? Ketogenic diet. Ketones help you save the muscle.
Gotcha.
So
where can our audience learn more about what you're doing and kind of connect with you on social media and things like this?
Probably. Well, I'm starting to try to do a little more social media. I'm busy with all these other things, but I am going to do more. Dr. Donese Worden on my website, they can go there, and I am going to get out there more on social. I'm really going to start doing more content on YouTube. So they'll be able to follow me soon. I like the speaking part, and that's on stages, but I've got to do a little more what you're doing. And I appreciate being on podcasts like this. You're great at it.
Thank you.
Good questions.
I appreciate that.
Good education. And I happen to know your intent is in the right place, and that is where it's really at.
Thank you. So drwarden.com, right?
Dr. Donese Worden. They'll find me. Just type in. I'm the only one that's DoneseWorden. They'll
Amazing.
find me wherever.
Thank you so much for your time.
You're welcome.
Appreciate it.